Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for the last 25 years. In this period, I have worked from tutor to professor to head of the department to dean. Students, I've been an examiner innumerable number of times in anatomy, theory as well as viva. And I want to share some knowledge with you today, how to successfully give your theory exams. How do you prepare for them? How do you deal with the stress of theory exam? And much more. Let's begin. The key to theory exam? Study, obviously. The key is to study. But how to study? What to study? It should be focused. Come on. So now that you know you have an exam, maybe you have a university exam or maybe you have a part exam, you have a terminal exam, whatever. Go to your anat department and request them to give you a sample paper. Sample paper not because you think that the same paper will come, no. But because you want to know how many SAQs, how many LAQs, how many one-liners, what is the paper pattern, okay, find out that. Sometimes if you have, for example, if you've given a prelim, then usually the same pattern will be followed in the university theory exam. So you can use your prelim paper also as a template, right? So you know how many LAQs, SAQs, you have a knowledge of that. Now let's begin to plan. I have a theory exam in a couple of weeks, several weeks later. How am I going to plan? Okay. So create a timetable, divide your week. Okay, suppose I have 6 weeks, 8 weeks, whatever. I'm going to divide my week into 4 days to study anatomy, 2 days to study physiology, and 1 day to study biochemistry. This is my experience talking. You can divide your days differently if you want. But what I have seen over the last 25 years is this is the way divisions have to be done for anatomy, for MBBS study or BDS study. Right. Now divide your revision. You know you have to revise. Divide your revision into first revision, second revision, and the third revision, which is just a day prior to the actual exam. Right. So what is first revision? Now here you are seeing a whole lot of the entire portion is given for MBBS. BDS can remove the portions which are not there for them. Okay, and suppose you have 24 days with you to study anatomy, then this is how you will divide it. About 1.5 days for superior extremity, 1.5 days for inferior extremity, and so on. Suppose you have less time. Okay, suppose you have barely 12 days. Then how do you divide your portion? 1.5 days for supex, infex, 1 day for thorax, 2.5 days for abdomen, and so on. See, all these divisions are made after a lot of thought process. So this is all possible, okay? So in this first division, try to cover everything. Be systematic, go into details. And if you leave something, if you're not able to do it, then remember to note it. So that next time when you study, you try and complete that topic as well. This is first revision. Now let's go to second revision. You're done with your first revision. Second revision is selective and fast. You're going to rush through the topic. You're going to just see if you remember. Here I'm giving you a second revision breakup for 8 days. You've got only 8 days with you. Now how do you divide your portion? In that I've given you half a day of miscellaneous. What is that? That is when you realize that there's something very important you have left. You just didn't have time to do it. So that half a day you will use for catching up with these topics which are important, but you haven't had time to touch them, right? So in 8 days, you revise your entire anatomy. Go at a good pace. Just keep on checking. Do I remember this? Do I remember this? Oh, I have forgotten this. Let me run through it. This is how your second revision should go. Third revision is 2 days prior to exam. What is the most important thing you will do? You will have faith in yourself. You have been studying. You've done first revision, you've done second revision. You may find yourself going blank, but actually you don't know. Have faith. Stay consistent. Don't care what others are doing. Who cares what they're doing? It's your exam. Focus. Just focus. Just keep telling yourself, I'm going to do my best. That is all I can do at this stage. I can't do anything else. So I must give my best and move forward. Idhar udhar nahi dekhne ka. Don't look here and there. Right. Revise, revise, revise with consistency and faith. Students, if you're liking this lecture, do like and subscribe to my channel. Now, finally, that day has come when you have your theory exam today. So you must be thinking, ma'am, done kya? If that's what you wanted to tell us? No. Now let's understand how to go for the paper. Have a bath, comb your hair, dress well and comfortably, tie up your hair. Ensure that no study material is in one of your pockets inadvertently. Check that. Sometimes by mistake you may have a little bit lying around in your pocket and it can lead to very sad circumstances for you. This is a list of things you should carry. Just take a screenshot of this. Pens, pencils, rubbers, hall ticket, some money. Keep your cell phone in your room. Don't carry it with you. If you keep it in your bag, you're all the time worried. Will it ring? Is somebody flicking my cell phone? So get that stress out of the way. Keep it locked in your room before you come for the exam. And if it is necessary, please wear an apron as well. So you can just take a screenshot of this. This is what you should be taking with you. Have your breakfast. Think positive thoughts. Don't go for the exam empty stomach. It's idiotic because that adds to your stress. Stop looking at others. Don't think, I don't know anything. They know more than me. What am I going to do now? How does it matter even if they know more than you? It is your exam. It is your battle. It is your challenge. It doesn't matter how much they know. The only thing that matters is, do you know enough? Are you going to be able to write it perfectly and get marks for yourself? Focus on yourself. Go inside. Okay? Plan your strategy. Some rules you should follow. Ensure you have a time division. How much time will you give for LAQ? How much time will you give for an SAQ? How much time will you give for a one marker? And stick to the plan, students. Stick to the plan. Don't get tempted to write more just because you know more. You have got only that much time. Nobody will allow you to write beyond 3 hours anyway. First thing now, you're now sitting in front of your paper. First, write the section. Read it and write it. Sometimes we have read the paper, we like a question, we start to write it. But on the top, we have written section B and you are writing the answer from section C. And you come back home to your hostel and then you realize you made a mistake. Now, suddenly you are so stressed out. The rest of the exam, all other papers will go in that stress. So check the section with your eyes, write it and begin writing your answer after that. Again, take a look here. Write the question and subsection clearly in the margin. Okay. See, examiners should not have to go looking for answers. Clearly write question 1, subsection A, B, C, whatever. Sometimes some of you solve some subsections late. Okay, it shouldn't be done, but if you have done it, come back to the correct question and write it there. Subsection C written at the end of the paper, so that the examiner knows and doesn't miss that subsection that you have written and you deserve marks for it. Now, let's solve each question. LAQ. LAQ is usually structured. LAQ is your strength. You are all scared of LAQs, but LAQ is actually very scoring. Let's take a look. Here you are seeing a question on medial longitudinal arch of foot, where they are saying enumerate the bones. 2 entire marks for only enumeration. Diagram. 2 entire marks for just drawing a diagram of set of bones. Description of arch, which is quite a few pages, is also carrying only 2 marks. Even if you don't write it perfectly, you will get 1.5. Okay. Factors maintaining arch, again 2 marks for quite a bit. And applied anatomy. So see, structured helps you to score easily. Okay. Attempt your LAQs well. It's a scoring part of your paper nowadays. Answer precisely what is asked. In this, have they asked about lateral longitudinal arch? No. Suppose you write it, will you get marks? No. So don't write it. It's not asked. Don't write stuff which is not asked in LAQs. Precisely answer the structured question. Let's go for one more. Here you're seeing a question on thyroid gland, gross anatomy, blood supply, microscopic structure, applied anatomy. Just answer what is asked. Suppose you begin to write development. Will it get you marks? No, because it's not asked. However, if you write a bit of development under applied anatomy, developmental anomalies, yes, that will fetch you marks. So be very clear in answering what has been asked, not writing what you have studied. You have to write what has been asked. Right. Let's now come to what you should do for all LAQs. Always draw a diagram. If LAQ includes histology, then remember, draw the diagram as well as write a few lines on it. 2 marks, you will not get 2 marks just for a diagram. A few lines will fetch you complete marks. Okay, so LAQ done. What about SAQ? Remember, SAQ is the trick of your paper. SAQs carry huge marks. Each SAQ is carrying 4 and 5 marks, and they don't have any structure. So the examiner can give you 1 mark also. Okay, because there is no structural division. So examiner feels this is rubbish, they'll give you 1. So attempt your SAQ with maturity and determination to do your best. Development of retina, microscopic structure of tongue, describe systematically, draw diagrams, write applied anatomy. Don't leave without writing applied anatomy. Give enough respect to your SAQ. This is where you're going to score over others if you do them well. Draw at least 1 diagram, students. Let's come to 1 markers and 2 markers. These are very easy to score if you know the answer, and very easy to get an anda if you don't know the answer. You have to know. Otherwise, you can't attempt. But what should you watch out against? Watch out against overwriting. Sometimes, for example, here there's a question asked, what is the nerve supply of biceps brachii muscle? Name other muscles supplied by that nerve. What will you do? Nerve supply of biceps brachii, musculocutaneous nerve. Simple. Other muscles supplied by that nerve, coracobrachialis, medial half of brachialis. End of answer, 1 out of 1. What do you do sometimes? You draw the musculocutaneous nerve. You draw the bicep brachii. What for? For 1 marker, you're not supposed to waste your time like this. Do not draw for 1 markers unless specifically asked to do so. Okay? Right. So your paper is over. Are you going to go now? Done? Absolutely not. Do not submit your paper and leave, because now your actual paper begins. You are now trying for the last 5 to 7 marks, which are sitting there if you are determined to get them. What do? You begin the paper all over again. You start to go through the paper. Have you filled out every structured question? Have you completed all expected questions? For example, suppose they say solve 6 out of 8. Have you done all 6? Or have you forgotten to do 1? Okay, so check all that. Never leave any question unattempted, students. Remember, even if you attempt and even 1 sentence makes sense, examiner has to give you some marks for it. Okay, so never leave a question unattempted. Go through every question. Somewhere your mind says, oh, I can add a little bit here. Add it. Add small points here and there. Add diagrams wherever necessary. It is possible for you that, okay, I remember this diagram. I think I can draw it. Draw it. Okay. Underline, highlight question numbers. If any question is left unattempted, now is your time to do it. Remember, you don't have to every time study to be able to answer. Common sense is your biggest friend. Use your common sense to add points here and there. Okay, you will be surprised at how many marks you will get for these additional last minute efforts of yours. So, when in the process of fight or flight, do not fight. Do not run away. Do not give your paper and run away. Sit there, go through it, fight for your last few marks as well. Right, so theory is over. Yay! Go back home, sleep, rest, sleep, rest. But get up the next day morning and start studying for Viva. If you waste too much time taking too long a break, your mind dissociates. It's very difficult to get the mind back into the game and start studying for your Viva. So while you take your rest, well-deserved rest, do not take too much of rest. Train your mind to come back into the game immediately next day. Let others enjoy if they want to. It's important that you get back into the game immediately. Okay? After Viva, you're going to enjoy, not before that. Right? So now there's a separate lecture on how to attempt Viva in anatomy. Please go through that as well. Link is given in the description section. All the best, students, for your exams. If you would like this lecture, do like and subscribe to my channel. Share your thoughts in the comment section. It will help me to make more such useful lectures for you. I enjoy taking this lecture, students. I hope you enjoyed listening to it. I'll see you across the screen in some other video. Thank you.